Eczema is a common condition that affects children, and it mainly presents itself by itchy skin. Joining us this week is Dr. Catherine Njeru, a pediatrician at the Gertrude Children's Hospital, to take us through what it means to have eczema and how it can be successfully managed. Stay with us. This is Mommy Talks. I am Catherine Karong'o. We can start by the definition of eczema. What is it?
Eczema is basically a recurring or chronic condition, meaning it's a rash that will come and go. Yeah? So in infants, that is children under 1, the main locations for presentation will be around the cheeks, on the scalp, on the tummy and back as well. As a child grows older, the location might vary a bit more, so on the arms and legs, so at the creases of the elbow, behind the knees, and then again, just as they progress into adulthood, around the wrist, the fingers, you start getting hand eczema, etc. You can just have simple eczema, or it can be complicated by infections on the skin as well.
What kind of infections can complicate it?
Yeah, so like bacterial infection, viral infection. So that's when the skin is inflamed, and so the bacteria and viruses take that advantage and infect that skin. So you have the base of eczema, but a bacterial or viral infection on top of it.
Okay. And what predisposes a child to eczema?
Alright, so it's important to remember that there's nothing that the mother or father did wrong for your child to get eczema. It's a mixture of your just genetic component. So let's say you're born with it in a sense, but that interacting with environmental factors. Yeah. So in the family, there's a history of allergic diseases. So that's like what we call hay fever. You get runny nose, especially when in the summer weather, hot weather, that kind of thing. So pollen irritation, or if there's eczema in the family, other family members with asthma. So basically, that's a condition we call atopy, or just sensitization to reacting to allergens in the environment. So once that is there, that is a risk factor for developing eczema. Yeah.
What about diet? Does it contribute to it?
Yes, that's an important, I think, factor to explore. Yes, there are certain children where they are eczema, so it will not cause it. They will already have eczema, but you'll find that the eczema is made worse, let's say by a food allergy. But we want to strongly communicate that mothers should not then stop foods hoping that it will cure the eczema. It doesn't work that way. In fact, the basis for treating eczema is just really skincare, rather than haphazardly stopping foods in the diet. That can in fact now lead to malnutrition, because I think the common myths that we hear from mothers is especially protein foods. Yeah, they blame that, and so they say, I'll stop this milk now, I'll stop eggs, I'll stop animal proteins, in a hope that it will take care of the eczema. But it's not always the cause. Let me say that. Yeah.
And how common is it in babies?
Eczema is quite common, I would say. So we don't necessarily have figures or studies in our own population to say that this percent. So we would be using just rough estimates that we get from the West, and they quote figures of about 20% of the population having eczema. So it's quite a common condition. Yes.
How can it be managed both at home and once you try to manage it at home and maybe it doesn't work, when you seek treatment, what kind of treatment do you go through?
Okay, so the first thing is just to get a correct diagnosis, because not every rash is eczema. And using over-the-counter creams, sometimes with steroids, can make it worse rather than better. So yes, come to the hospital just so that a specialist can have a look and at least give you a correct diagnosis. And then from then on, it's really just skincare. And what I mean by that is, we've said eczema is a condition where your skin is dry. So making sure that you're on top of your game with moisturization. So there are different kind of products that moisturize the skin, and that can be advised depending on the condition, how bad it is. So applying those as frequently as needed, avoiding harsh or medicated or perfumed soaps that tend to dry out and irritate the skin even more. And then in conditions where there's a flare up, we might prescribe steroid creams to sort of soothe the area. But really the basis will be moisturizing and taking care of the skin.
Okay. You find that in most babies it flares up once in a while. So one time it flares up, then it goes down. What are the triggers to this, and what can a parent do to avoid these triggers?
Right. So I'm going to repeat this many times, but just the basis of moisturizing and taking care of the skin. Because once that isn't done, then you get a vicious cycle of the skin is dry and itchy, the child is irritated and is scratching the area, and that worsens and continues this cycle. So one, moisturize, moisturize, moisturize. Two is avoid the irritants. I've mentioned maybe some kinds of soaps, let's say the medicated or perfumed or harsh soaps that can make it worse. Three is overdressing. We fear cold in our culture. I don't know why. And so you'll find in weather like this, a child has 5 layers of clothes. So the moment they are sweating a lot, that is definitely going to be an irritant. Rough fabrics as well. So whatever is in direct contact with the skin should be nice and smooth fabric. And then any fabric products you're using that remain on the clothes, yeah. So like your final rinse, whether it's a fabric softener, those particles that remain can actually also cause a trigger or a flare up. Basically that. Yeah.
Okay. And does it ever go away, or it's something that a baby has to live with?
Okay. Again, yeah. So the answer for that is, again, studies that they've done and followed up children with eczema and seen. And so the rough numbers are that up to half of children with eczema, when they reach puberty, it will either go away or get significantly better. The rest will continue to have eczema, but it's a condition that can be well managed, and there's no reason for a child not to have a completely healthy life.
But it's not fatal, is it?
It's not fatal. However, I wouldn't like to downplay the effects it has, especially just growing up, especially if it's eczema on the face or somewhere where it's visible. That of course can have effects on the child's psychosocial health. Sometimes it gets very itchy that they can't even sleep well, and that of course is detrimental to their development. And then now the infections, yeah. So if the skin is not taken care of, then it gets infections which now can become serious or can go further down into the skin.
Anything else you'd like to add?
Yes, I mean, you just need a lot of patience. I think that's what I'd like to tell moms with children with eczema. A lot of times we are looking for a quick fix, this wonder drug that will clear the skin, make it very smooth, and sometimes steroids do that. But really the cornerstone of taking care of eczema is just managing the skin and being patient and finding the right products that work for your baby.
Thank you for staying with us. We hope that you've learned from today's episode. Join us again next week when we discuss infant jaundice, a condition that affects about 50% of infants. Until then, stay safe and goodbye.